My future ends. So you decided to go to nursing school to become a nurse. Yay! Excellent choice. Because according to the Bureau of Labor and Statistics, we will need an additional 275,000 nurses by 2030. So you made an excellent choice. And employment opportunities for nurses in the next 5 years will grow faster than any other occupation. And I'm sure you came about this decision after in-depth research. You dotted all your I's, you crossed all your T's, and you made your choice. So, should I become a nurse or an accountant? Well, I hate math. Nursing it is. I hope that is not the way you made your decision, because nursing impacts every single human being on earth. So please let that not be the way. Well, no matter how you came about your decision to become a nurse, I'm going to share with you some knowledge of what to expect from nursing school. So stay tuned. Before we get into content, click this button, and click that button. That's all you need to do. Welcome back, Future Ends. So, you decided to go to nursing school and become a nurse. Yes. So, just to let you know, nursing schools and nursing programs is not like any other program or any other experiences you will have in school. So, having insider knowledge of what to expect when you walk into that nursing school will help you be more confident. I'm going to go over 6 expectations that you should have when you start your nursing program. Expectation number 1, everything that you learn from day 1 of nursing school will be tested on your NCLEX boards. In other words, your fundamentals or foundations course sets the base structure of your nursing knowledge. So it's very important. Interestingly, most students, once they reach their final semester, while they're taking all these testings, these assessment tests, their actual weakest area turns out to be fundamentals. Yes, you could say fundamentals was long ago and you forgot those concepts, but it's important not to forget. Notice this pie chart from the National Council of State Board of Nursing test plan. It shows a distribution of content. Notice management of care. That has the highest allocation on the boards. Now, notice the topics covered in management of care. I would say that 90% of these concepts are introduced and covered in your fundamentals course. So, everything that you learn from day 1 will be tested on the boards. Expectation 2, nursing school is a full-time schedule. If you are working full-time or part-time, if you have a family, if you have other responsibilities, and you want to go to nursing school, you have to learn to manage your time in order to be successful. Note, for every 1 hour of classroom didactic learning, you need to allocate 2 hours of studying and reading your textbook. So if you have a 3-hour course, that would be 6 hours of studying for that course. And if you're taking 4 courses in a semester, that would be equivalent to 24 hours of studying a week. Then you have to add your clinicals, and then your lab time, and then hands-on practice. And if you have work and kids and other responsibilities, that changes the dynamic. So if you have not mastered yet time management, start now. Expectation number 3, expect a dress code in nursing school. The nursing profession is just that, a profession. So professionalism or a set of standards is expected. So when you go to nursing school, you might be expected to cover tattoos or remove any extra piercings that you might have. All of this is not to infringe on your personal rights as an individual. Note that you are caring for persons from a variety of backgrounds, a variety of cultures, and you have to be culturally sensitive. So having a neutral presence, especially as a nursing student, is very important. Other requirements for dress code: if you have long flowing hair, you need to put it up. If you have artificial nails, gel nails, or a non-clear polish, you would need to adjust to that expectation. And that is an infection control issue. And you will learn that's right, in your fundamentals course. So expect a dress code in nursing school. Expectation number 4, every experience in nursing school is a learning opportunity. So what I mean by this is, in nursing school, in clinicals, you will witness correct way to do things and the not so correct way to do things. You will see the wrong way to do things that would have you question, did this person ever go to nursing school? You can also see the OMG, someone needs to call the state wrong way to do things. You will have these experiences in clinical, in simulation, in your lab. Learn from each one of those experiences. Learn from each one of those experiences, even if it's not your own. These experiences will add to your body of knowledge, and you can actually also use it as a scenario in a job interview. Expectation number 5, nursing exam questions are not black and white. You cannot approach nursing exam questions with the idea that if it walks like a duck, quacks like a duck, it's a duck. That could work in accounting, 1 + 1 always equals 2. But in nursing, it's more like if it walks like a duck, quacks like a duck, it's a platypus. So remember, you're not just dealing with disease, you're dealing with human level needs. And the human being is dynamic, they're emotional, they're always changing. In the context in which they present at that point in their life matters. Here's an example. What would you do for a patient who comes in with high blood pressure through the ER complaining of a headache would be different as what you would do for a patient 6 hours post-op with high blood pressure complaining of 10 out of 10 pain versus the patient with high blood pressure and you witness their spouse running out of the room hysterically crying. All those examples, the key thing is high blood pressure, but your nursing management would differ for all 3 of these patients. But the same blood pressure issue, but because each patient is living in a different context, therefore your nursing management, your nursing treatment of that patient would differ. Platypus. So nursing exam questions are not black and white. Expectation number 6. Do not expect to graduate with all the colleagues that you enter nursing school with. The reality is you and your classmates may not graduate at the time you expect to graduate. You all are on a different journey. Your learning experience, it's individual. It's not a race. Suppose life happened right in the middle of your med surg course, and you did not pass because you could not get that ABG interpretation. So don't beat yourself up. Sometimes you have to take a step back, recognize and work on your weak areas in order to move ahead. This will make you a stronger, more proficient nurse. So remember, your nursing school experience is individualized. So we went over 6 expectations that you should have when you're going into nursing school. Now, take this information and go and make your dreams come true. Wait a minute. This is not Disney World. They're going into nursing school. Scratch that. Now that you have some insights into the expectation of nursing school, take that knowledge, because knowledge is power, and be the best nursing students you can be. So future RNs, if you found this video beneficial, please don't forget to like and subscribe, and check out more of our content in our channel. See you soon.